So the next Ask ID question is about sunscreen. And this is from a patient saying, I was wondering, am I fully protected if I use the once daily sunscreen, once I ensure that I use a high factor such as factor 50? And this is actually a really good question. And the answer is unfortunately no. It would be great if we could just put on sunscreen once in a day and think that we were taken care of for the whole day. But this is actually not going to be sufficient to protect your skin from the formation of fine lines and wrinkles, pigmentation, broken capillaries, and also to protect you against the development of skin cancer. So it's really important that if you're going to use a sunscreen, that you certainly do pick a protection factor of at least 14 above for the summer months and 13 above from the winter months. I have a preference that I just stick with a high factor all year round, so that I know that my skin is protected, and it's really important that we all use it every 2 hours in order to protect our skin. And the reason for this is that, number one, none of us ever put on a sufficient amount of sunscreen, and also number two, you're going to sweat it off, you're going to be in the swimming pool, for example, you're going to rub it off, it's going to wash off with the water. So it is really important that you reapply it, otherwise you will find out that evening that your skin starts to burn and tingle, and you realise that you've actually not put on enough sunscreen frequently enough. This is also really timely because it's Melanoma Awareness Month for the month of May, so it's really important to get used to looking at your skin. And you can get these leaflets. We have them obviously in all of our clinics, and you've probably seen them maybe in your GP practice, but these are from the Irish Skin Foundation, looking at how to protect your skin and signs of melanoma. So we use the alphabet A, B, C, D, and E, looking at ways to look at our moles and to check that they are healthy moles essentially. And this is something that you need to get used to, that you'd be looking for the A, B, C, D, and E. And basically with this, A is for asymmetry. So if you think that your mole is starting to look different, that the shape of it is changing, if you think the border is becoming irregular, some more jagged edges rather than smooth, oval or circular, if you think that the color is changing so that there's more than one color in it, or that one side is looking darker than the other, if you think the diameter is increasing, so it started off as a small little mole and it's increasing beyond 6 millimeters is the rough figure that we use. But of course, if you think any mole is changing at all, you would get it checked. And then E is for essentially evolution. So if you think a mole is changing the shape, the size, the color, you do want to get it checked out. So I would say the answer to that question is no, it's not okay to use sunscreen just once a day, even if it is advertised as that. It is important to use enough of it and to reapply it every 2 hours, especially if you are in a hot environment where you're sweating, or you've been in the water, in the sea or in the pool. My favorite go-to is the EltaMD UV Clear Tinted for the face as my preference, because I'm prone to pigmentation, so this is better protection. So this is both physical component as well, so it has your zinc oxide basically to protect the skin. And my go-to for the body is the Elta UV Sport. This is water resistant. There's no such thing as waterproof sunscreen, so some of it obviously will wash off, but it is water resistant for up to 80 minutes, and it doesn't leave you looking completely like a white cast. It has a slight sheen to the skin, but it actually just gives it a glow, and it dries in really nicely. And for my really sporty patients who want it maybe on the top of their head if they're going cycling, it doesn't run down and cause stinginess in the eyes. So again, do not use your sunscreen only once in a day, and do learn how to check your moles. So use the alphabet A, B, C, D, and E to check for changes in your moles.